It is ridiculous and it is against the laws of nature that we can have somebody sitting pretty who takes home more money than the credible entrepreneur who is doing actual production of goods and services.
We always say it as it is.
It is only in this country that when a thief is arrested, you hear elders from their tribe saying, he is our son and he is our thief.
If you are deviant
Yes.
and I call you leader, probably you are already a leader, but you are leading in the wrong direction.
We want to see the role of the youth
Yeah.
in the security,
Yes.
governance,
Yes.
and development.
The youth that I meet and work with here, you know, we call them the millennials and X's and Y's, this and that. They don't necessarily want to live like their fathers and grandfathers,
Yes.
do business like their fathers and grandfathers. They're more independent, they're better educated, and they're the ones that are making everything move in this region.
We look at the issues, we talk about issues that impact people's lives in Africa.
The African peoples themselves continue to cheer bad leaders, and because they cheer them on, they continue to be misled.
Let me ask you, doctor, would you rather be somebody who does not enjoy so much freedom but you are rich?
Yes.
Or you'd rather be poor who you are actually imprisoned by the poverty itself?
My goal is not to come here and say, I want the majority ownership, I want to own this, I want to own that, I want to do this. My goal is we all make money and we're all happy, and I help build a big business here.
Punchline is for Africa, with Africa, from Africa.
Good afternoon. Fellow Kenyans, today marks the 21st day since I last addressed you on the 6th of July of this year. And on that day, in order, as many Kenyans had desired, to be able to reopen our economy, I did reduce some measures that we had taken against COVID-19. But I remind each and every one of you that on that same day, as we answered your call for a reopening of an economy, I did make it abundantly clear that the government's response was also made alongside another call, a call to individual and collective responsibility in our response to this pandemic. This process of de-escalating the measures against the pandemic, needed by all citizens, required for each and every one of us to be more serious in all the health protocols that had been put forward to us by the professionals and health experts concerned. These included, amongst other things, a more serious approach to wearing of masks, sanitizing as often as we can, keeping social distancing, amongst other protocols that we are all familiar with. So, fellow Kenyans, we have had 3 weeks to assess the response. This morning, I chaired, in conjunction with my co-chair, Governor Oparanya, who is the chairman of the Council of Governors, we did chair the 5th Extraordinary Summit of the national and county governments. This is the 3rd consultation that we have had on where we stand as a country against one of the greatest health as well as economic threats that has faced humanity over the last century. Well, the results are in. The surge in infections has continued for the last 21 days. And in some areas, notably our capital city, this has accelerated sharply. Today, the virus has infected 44 out of our 47 counties. Nationally, 17,603 persons have so far tested positive for the virus. And my and our meeting's greatest concern at this moment is the aggressive surge of infections among young Kenyans who are in turn, unfortunately, affecting their elders. Contact tracing of the recent surge of infections indicates that our socializing without regard to protective behavior, particularly in an environment serving alcohol, is becoming one of the greatest risk factors in our country. As a nation, we are fortunate that the case fatality rate, which currently stands at about 1.6%, is much lower than the global average. And from our discussions this morning, we think that perhaps it is this relatively low rate that is giving Kenyans false comfort, and I repeat that, false comfort, that this pandemic is not a serious health risk to them and indeed to their families. Those are the people who have somehow interpreted the de-escalation of the measures that we took to de-escalate 21 days ago as a green light to pay no heed to the guidance by our health authorities. And their reckless actions are undoubtedly endangering those around them and endangering our whole country. I must also once again remind Kenyans of what I said 21 days ago, and that is that the government cannot police the morality of its citizens. Citizens must balance between their individual rights and their responsibility to each other. We cannot have a policeman in every street, in every village, in every home to enforce the rules. We need, as citizens, to hold each other accountable. For example, if someone enters your shop, you want the business, but if he has no mask, you must insist that they wear one. If you go to a restaurant and the waiter who serves you has not complied with the health protocols that have been set, walk away and take your business to another restaurant. Speak up. Report those who refuse to obey and even refuse their business. Do your part as a citizen, as an individual, to keep you and your loved ones safe. My friends, this is not what one would call normal times. We are living globally in abnormal times. Countries whose citizens have taken a careless or relaxed attitude have suffered greatly. Let us not think that we are immune or special. We're not. Please, fellow Kenyans, let us not follow the examples that we have seen across the world. The fact that countries do not report everything that happens in their countries. We are an open society. We tell our story. Our media is free. We do everything we can to tell the facts as they are. There are many other countries that are suffering greater than we are, but don't report, but don't say. So don't look at yourself as being special. We are not. None of us is. We are all children of God. And this disease has infiltrated all of us. Indeed, some who have the most extensive and advanced medical facilities in the world have been completely overwhelmed by this disease. You only need to follow news reports to see the truth of that. They are sick by the tens of thousands, have had to endure the suffering of loneliness as comforting visitors are kept away in order to prevent infection. In many countries, they even lack sufficient space in their mortuaries to hold bodies, and bodies are left lying on streets. We have seen reports across of graves that have been dug by the tens of thousands for very lonely, scary burials, as health authorities limit the numbers who cannot mourn at the graveside. We have even seen stories and seen pictures of people being buried unceremoniously at night. We cannot allow this to be our fate in Kenya. Today, we mourn 280 Kenyans who have lost their lives to the cruel virus. And unfortunately, fellow Kenyans, because truth must be told, there will be more. The only question is whether we shall emerge with low numbers of death, or we are going to suffer a catastrophe. The harsh reality, my friends, is that we are at war. At war with an invisible enemy who is relentless in their desire for destruction. But as in war, no mercy must be shown by either side. For in war, survival is the only key. Self-preservation is the priority for all in the theater of war. This is precisely the level of danger we find ourselves in today. And COVID-19 will only be defeated if Kenyans stand shoulder to shoulder with each other and take arms together. In war, victory is assured by united armies that pursue a singular aim of subjugating the enemy. Our victory will be to suffer minimal harm and minimal loss, and to shorten the length of this war. So therefore, dear friends, it is time for each and every one of us to get realistic. We must be realistic as parents. We must be realistic as brothers and sisters. We must be realistic as colleagues. We must be realistic as neighbors. We need to look around each other and to ask ourselves, what is my responsibility to those around me? What is my responsibility to those that I love and care about? I say this because they are the people that your actions are going to impact going forward. I do believe that none of us want to mourn parents, brothers, sisters, friends, and colleagues who would have survived were it not for our actions. Nor do I believe you would want them to mourn you. The power, therefore, is in our hands, yours and mine. We, individually and collectively, are the ones who have the power to save. I continue to say, wear your mask, wash your hands, keep your distance. And you do these things because you are a responsible and caring person, not because the government has told you to do so. You do so because you believe it is the right thing for you to do. We all have to step up to being responsible. And this, especially in the case of leaders, especially elected ones. And so therefore, all the measures that I will be announcing today shall be applied to all citizens, regardless of their social or political standing. When we de-escalated 21 days ago, I said that I would not hesitate to re-escalate again if reckless behavior is widespread. Accordingly, in response to today's resolutions from my consultations with county governors and on the advice of the National Security Council and the National Emergency Response Committee on the coronavirus pandemic, I do further order and direct as follows: that our nationwide curfew shall remain in force for a further 30 days. that there shall be no sale of alcoholic beverages or drinks in eateries and restaurants across the territory of the Republic of Kenya, effective midnight today for the next 30 days. That the closing time for restaurants and eateries has been amended from 8 p.m. to 7 p.m. starting today at midnight for the next 30 days. That all bars shall remain closed until further notice. That the Inspector General of the National Police Service shall cause withdrawal of all licenses for bars operating in breach of this directive, and those withdrawals shall be permanent. That the Inspector General shall file a weekly return of all bars whose licenses have been withdrawn to the Cabinet Secretary for Interior and Coordination of National Government. That forthwith the Inspector General of Police shall ensure that his officers spare no Mheshimiwa, no individual, irregardless of social status or rank, who is either out after curfew without being an essential worker, or who flaunts the health protocols that have been set out. The rules are for all of us, and rank or status does not exempt anyone from them. That the National Government Administration officers and the National Police Service will strictly enforce Ministry of Health protocols on public gatherings and particularly funerals. That strict personal sanction will ensue to all police and national administration officers in whose areas of jurisdiction there is a breach of the said guidelines. That the Ministry of Health will develop a protocol to temporarily retain retired ICU staff and anesthesiasts to support the medical staff assigned to dealing with serious COVID-19 cases in the counties. That any government institution, including all sporting facilities, stadia, educational institutions, and other government facilities, upon designation by the Cabinet Secretary for Health as a public health facility, shall be availed to the Ministry of Health for isolation and quarantine purposes. If and when necessary, these measures will be made even more stringent. We will do this without hesitation because we hold precious the life of every Kenyan. We also understand that our economic health as a country is ultimately tied to keeping our infections and fatalities as low as possible. So for those who argue the economic argument, I tell you that there will be little tourism, scarce investment, and falling trade if our headlines start to match those of countries that have been hardest hit by the pandemic. So if we want to preserve our economic health, we must begin by preserving our physical health, and that is a responsibility for all of us. I want at this juncture to thank, through my co-chair, the chairman of the Council of Governors, all the governors of the Republic of Kenya for the efforts that they are making individually and collectively. In today's briefing, I am encouraged to note that over 70% of county governments have met the set irreducible minimum that we agreed on a few weeks ago. This is only the start. We have urged each other to do more, to reach full compliance, and to go even further. And I have promised to work with them to help keep Kenyans working and producing as much as possible during this difficult time. We reminded each other, and let me remind Kenyans, that this is not a competition. It is not a competition between the national government and county governments. It is not a competition amongst counties as to who is doing better than the other. It is not a competition between political groupings. This, brothers and sisters, is a war that we shall either drown together or we shall hold each other up and see the glory of God as we celebrate our victory against this invisible enemy. We honor the souls of all we have lost to coronavirus, but I want to especially...
Good morning, Africa, wherever you are. Thank you very much. This is our show, Kenya Today. This show is specifically for the people of Kenya. It looks at the Kenyan situation. What is happening in Kenya on COVID-19? What is happening in Kenya in politics? What is happening in Kenya on revenue allocations, BBI, economy? So many economists are writing long essays. Don't write long essays, just write a solution that can bring back this continent or this nation. I read David Indy's a long essay. It's inept. It doesn't carry anything that can help Kenya, only to divide Kenya more. But let me come back to that. That's another subject for another day. Good morning, Miriam, in the studios in Nairobi, Kenya.
A very good morning to you, Doctor, and the rest of our panelists, and of course our viewers. A very good morning to you.
Good morning to you, Professor Onyari in Nairobi, in Kenya. Thank you very much for joining us. Professor Gerard Onyari is our in-house analyst, and that he always says it as it is. We might not agree on a number of things, but he should remember doctor's lecture, professor's offer. Thank you very much. I think he knows the doctrine very well.
Good morning, Dr. Masanga and Miriam and our viewers.
Yes. Thank you very much, viewers, wherever you are in Kenya and abroad in the diaspora watching this program. This is Kenya Today. We've started with the numbers of COVID-19 by Miriam in the studios in Nairobi. Thank you. I am Dr. Matsanga in the Political Command Center, miles away from Miriam in Nairobi. Thank you very much, all of you. Take it away, Miriam.
All right, thank you so much there, Doctor. So as we speak this morning, the number of confirmed cases in Kenya is 17,975 cases. The death toll is 285. Recoveries right now stands at 7,833. Uganda, the confirmed cases is 1,128. 2 people so far have died, and recoveries is at 986. And Zimbabwe, the cases there's 2,704. The death toll is 36. Recoveries is 542. And South Africa, the cases there is 452,529 cases. The death toll is 7,067, and recoveries is 274,925. And South Sudan also there are 2,305 cases. 46 people have died. Recoveries is 1,175. Rwanda, 1,821 cases. 5 people have died. Recoveries is 918. And Burundi, the cases have slightly gone up there at 378. 1 person has died. Recoveries is at 301. So Burundi is doing pretty well. And of course, the total cases in Africa this morning stands at 846,646, and the number of people who have died in the continent is at 17,159, and the recovery so far is at 491,399, and the global cases right now stands at over 16.6 million cases, and the death toll is about 656,677, and recoveries globally right now are over 10.2 million cases so far. So, Doctor, there it is. And I don't know if you watched that video of another lady, a doctor from Nigeria, who President Donald Trump has shared. And she said that she has treated over 300 patients and they've all recovered. None of them has died. And she's been using hydrochloroquine and another medicine and zinc. So perhaps we do have the solution according to her.
Yes. I think I've watched that video. She's being honest. She's being honest. This disease is coming more or less as malaria. It will end up with our control. It is going to be endemic, the way I see. But before it becomes endemic, I want to be very honest. It will go with very many people. All of us, we are at a risk. All of us, we are at a risk. There is nobody who knows whether he's all right or not, because this disease is invisible. Had we known that mosquitoes come and bite you, we go and kill the mosquito. But we cannot kill, we don't know where the disease is. The disease is in the air, it's invisible. You can get it anywhere if you don't wash hands, if you eat you walk without a mask, you don't social distance, you'll get it. We don't know. And it goes for those people with several underlining. All of us, all human beings have their own underlining methods. There's nobody in the world who says he has never been to a hospital injected. My last injection was in 1985. Yes, of Mega 5. You remember Professor Mega 5? The one that it is as a result. Yes, all men know what Mega 5 is, which I don't want to make Miriam's day very bad this morning.
But you're making me curious.
All men know what Mega 5, okay. PPF 5.
Okay.
Yes, syringe. Yes.
It was thrown like a spear like that.
No, Miriam, don't go into that thing. Okay. It is dangerous.
Let's leave Mega 5 alone. Okay.
Yes, Mega 5 was the most effective medicine. PPF, that is what they call it. PPF, chloroquine. Those were the concoctions that we took. When, for example, I want to tell people we used to have a disease called mumps. Many of you have suffered from mumps watching us. If you say you have not suffered from mumps, then you are lying. You are not an African. Most Africans suffer with mumps. the disease that makes your the ears grow big.
Swell.
But
Swelling.
when you go home, they put in the hospital, they put the purple substance which goes in. But back at home, there is a concoction that they make, unakunywa. It is curry. It brings out everything. Boom! Once. So every man knows the problem that COVID-19 is invisible. Believe me or not, COVID-19, had it been mosquitoes coming to spread it, we can go and spread the mosquito pond. But this one, as President Uhuru Kenyatta said it last night, and I want to laud President Uhuru Kenyatta for taking steps, for listening to the people's cry, for people who drink every night up to 4 a.m. as if there is no disease here. Someone calling you at 4 a.m. I'm in a restaurant, David Camp. Which is this restaurant? When I told him I'm coming now, I'm sending the police officers. He said, he rang back, he said, my friend, don't bring trouble. Yes. And I've warned him that if he says, no, I will announce it here. Someone was in a restaurant eating nyama up to 4 a.m., 2 a.m., and they're calling you to come. Haki, to come to eat nyama at 2 a.m. So there are restaurants open here. Mr. President, we shall not die because alcohol can be drunk in the houses. If you want, the most valuable thing is water. And we want to thank the Nairobi Metropolitan Services for drilling water everywhere. Yes.
Yeah, there are water points in places where they're, especially the slums and the densely populated areas.
Yes.
He's doing very well.
Thank you. We shall collect this water and drink at night. After all, in fact, the president's decision saves most of us a lot of money. Because some of us, as soon as we reach these bars, so many people, hunger zone, come to you. They drink your beer. Yes. There's 2 years ago, 3 years ago, I had to live in a certain hotel. Because every time I go to sit in that place, oh, Daktari, oh, Daktari, oh, Daktari, oh. I leave the place with a bill of 40,000. Some people, even when they see me in the restaurant, I won't name the hotel. 3 years ago, I suffered. They see you in the restaurant, by the time you wake up, you are about to go. The waiters come to you, oh, you remember the other friend of yours who was seated in the corner. Professor and Miriam, I suffered a great deal. And one of the things that my father told me is to ever quarrel with a waiter or a waitress. There were 4 people my father told me before he died never to quarrel with. A taxi driver, a receptionist, a guard, a waiter, and a wife.
And a doctor.
Yeah?
And a
no.
doctor.
Doctor, we can quarrel. If you are giving me wrong advice and I know that you are giving me wrong to kill me, I quarrel with you.
And they might give you a wrong one to silence you forever.
Yes. But those are the people my father told me never to quarrel with. And whenever you go anywhere and mark this, you will be very, Miriam, never quarrel with a guard, never quarrel with a receptionist, never quarrel with a taxi driver, never quarrel with a waiter and never quarrel with your husband. We Ugandan men have speciality. We don't quarrel. We walk out and go and have a drink.
Now there's no
in the pub.
There's no having a drink, Doctor. Now what do you do? Take a walk?
For 42 years I've been married. When I see my wife bringing problem, I look for the keys quietly. We shall sort later. By the time she's charged to a level, high level, David, where are you? I've gone. Then now the temper is down. She said, oh, you left the house without telling us. Let me see how you'll come back. Fine. So I go and have a drink. In my pub, there's a pub called the Lion pub down where we used to meet with the late Colmo when he was working with BT, British Telecom in Croydon. So while I'm in the pub, I said, now I can't drive the car. Say, now you gave us a headache. Okay, I'm walking down. Or I'm getting a cab to come and bring you because I have drunk. I've taken some liquor, I can't touch the steering. That's how to control a wife. Don't beat her, don't quarrel with her. You saw yesterday a clip that is running around the whole world. A Ugandan lady having a V8. I don't know whether that clip, you have seen it, Miriam. It is on my Facebook. The woman went for the windows, for everything, destroying the husband's car. But this poor husband was watching the wife. He not touched to beat. How many men here would pull pistols and shoot this woman?
Because the man was probably very, very wrong. So
even if you are even if you are not wrong, at times you cannot be wrong. Even the daughter is saying, "Mommy is beating someone." Then the husband is saying, "Mommy is destroying the car." You know. Then the woman comes and says, "Don't tell my children that." And that is what translated in Uganda from English. English from Uganda. If you look at that clip, Professor, you will understand the pain. So one of the things that President Uhuru Kenyatta has done is to help us not to spend more. Mr. President, that's a good decision. If you want a drink, buy your drink and go home. After showering, you shower nicely, have everything, and then get a nice novel. Put your legs and read while Mama is cooking. Don't drink. The president has saved us a lot of money. Because some of us find unnecessary inconveniences. My father told me never to quarrel with a waiter. Because when they bring you a bill, somebody has drunk and gone already. And you're a very high respected man in a community like me, at my age, to quarrel over a bill of 3,000 shillings or 4. The man has drunk and gone home. And when he has reached home, he said, "David, I am okay home, I'm rich." But he doesn't say thank you for paying the bill. That is the situation I have. That's the suffering that I have got. So I have suffered. Many, not only me, millions have suffered. Millions of cash is spent. In 1 month, this month alone, millions of Kenyans are going to save a lot of money. Because there will be no bar to go to hang around. Yes, and no is willing to have the police withdraw the license forever. You know, they have said time is not known. Even if you go to the court.
And that is what, Doctor, we were saying here when we saw those Kenyans who are being caught in the middle of the night or past the curfew hours in bars and clubs drinking in the middle of the night. And we're thinking, why are these establishments allowing these people to be here at that time and they know they're breaking the law? And we suggested that perhaps, you know, these licenses needs to be revoked. So the president must have heard us. He came out and said we allowed a partial reopening, and we were hoping you will be responsible, but you have proved that you're not even, for the people who are owning these establishments, you're not working with the government, you don't care about the measures that have been put in place, and so you're exposing a lot of Kenyans to risks of contracting COVID-19 by opening and extending, you know, these hours and also not allowing social distancing. So I think, yeah, if you cannot hear, because the government has really been very lenient when it comes to some of these measures and just allowing, because they understand that this is also some, you know, they also, you know, contribute to our economy. So the government allowed for the businesses to come in and to start running, and they were given some regulations. But now you see they're abusing these privileges and this, you know, the goodwill from the government. So I think they'll have themselves to blame. And I think right now the law will take its course very, very seriously there. So yeah, they brought it upon themselves. Prof.
Thank you very much.
Yeah.
Professor, anyone?
Yeah, what I have to say that the president brought it out very clearly that we are at war. And when we are at war, all of us must be focused. Someone must be able to do his or our role. I have mentioned here before, and I'm saying that the government has done what is humanly possible to be done. But the people need to change their behavior.
Mindset.
They have to change their mindset, that's right.
Yeah.
And we can be able to change lives.
Yeah.
Those who want to drink, fine, buy your alcohol, whichever beverage you have, go to your house, drink. And the president has taken war. Don't kill innocent Kenyans. Go and kill your beloved ones. Kill your children, kill your wife, kill your mom, kill your friends. But he has said, spare the people of Kenya. That's why he has gone to that extent. And then, I did say this, let me just bring the spiritual implication. During the time for Noah, the floods, he cleared everything and changed life. And God is going to change the world through COVID. And he has changed. So those who are saying, oh, you want to go to your normal, no way. COVID-19 is here with us. We have to learn to live with it. Wash your hands. Keep social distance. Don't be in a crowded places. Keep hygiene. And be your brothers and sisters' keeper. And we will take this COVID away from us. COVID does not come to us. It is us who invite it. So let us be our brother's keeper, as the president has alluded. And what we need to do, let us all of us team up. This is a pandemic. We are at war. You never know how many people are going to be killed until the cure is going to be found. So let us not gamble. Let us not take us a joke. Let us support all the government protocols which has been put in place, and we will be safe. And to me, I have to say, our president has done extremely very well. And let me tell you, we keep on talking about the regas, Agenda 1, 2, 3, 4. This is one of the hardest wars the president has fought. And this is a great regas. Many years when we have all gone, history will come to record President Uhuru Muigai Kenyatta, how devoted and he was committed to fight this pandemic. See, when he addressed the nation, how he feels for us. Let us fight COVID-19, all of us.
Yeah, and on the front pages of the Standard newspaper up there, Doctor, it says Uhuru strikes at bars and leaders behaving badly. Corona fight amid rising cases. Uhuru spares Kenyans another lockdown, but outlaws sale of alcohol in eateries and extends closure of bars. Alomba, I don't know, what is your take on this and President Uhuru's public address yesterday?
Thank you so much, Miriam, and fellow panelists. I want to really thank the president. He acted in wisdom yesterday. But then I want to say this. Right now, Miriam, we are in a hole. And when you are in a hole, the best thing to do is to stop digging. I ask myself, what is it that is so important about drinking? What is it about partying that is so important than the life of Kenya? It is high time, like the gentleman had said before. We must change. We must have a behavior change. Things are not normal. These are not normal times. We can't just go out there, walk, because Miriam, this particular disease does not walk. It is us moving out with it. People are talking about, let us reopen the economy. Reopen the economy to go where? Doctor is asked, where do you want to go? There was a time they were crying about Uhuru, the president, to open Nairobi. None of my friends who are crying are even traveling. They are just here. So really, Kenyans really need to change. We are taking things for granted. Yesterday, I saw there was a lot of media, social media engagement, people making fun of the president. A very interesting blogger said, Uhuru is acting as if he's not one of us. Sisi walevi. You see? I think we really need to be disciplined. And I ask the president to even escalate more stringent measures. And in Kisumu, let me also tell you, in these informal sectors, the police officers are drunk from morning to evening. I wake up in the morning and the first person I meet is a drunk police officer. And if you walk around, they're the people encouraging these things. So really, I think somebody needs just to wake up and ensure that this particular how do we call it, the protocols are adhered to, even if it means revoking the licenses. Let him do so. I know I know this particular people they inject some capital to the economy, but then can that be more important than lives that we are going to lose? Thank you.
All right, a very pregnant question there, Doctor. Very interesting things there that Alomba has brought about and is saying where he is right now. The law keepers have become the law breakers. Inspector General Mtimbe, please, some important information there for your action. But Doctor, what do you say to that?
Yes, we call upon the Inspector General of Police to check on policemen in Kisumu. They drink. Yes. And for us, we don't have anything to hide. Why do we hide? IG, that's the report. This man is on the ground. You wake up in the morning, you find the policeman is drunk. You can't tell him your problem. First he asks you, why are you also awake at this time? Do you know that they ask you such a question? And why are you awake at this time? Miriam, take over.
That is, Doctor, I mean, Professor, that information there by Alomba there, it's quite serious though. I know it sounds funny, but not really. If the law enforcers, and now some of them, not all of them, we have very good police officers in this country.
Yes, Miriam. The president yesterday gave express instructions. And you know, the president does not talk for the sake of talking. It's not like us who can talk and nothing happens. He gave instruction to Inspector General to make no more returns on daily basis to the CS interior. And it's getting some of the information, and the people who have to assist the government and protect us are the police. The police, their work is to protect life and property. So if you are protecting life and you are the one who is drunk, how can you see one who is already breaking the protocols?
Another thing,
my appeal to the Inspector General, take action, and my appeal to the police, please, you have been to the training. We are at war with an invisible enemy. We cannot afford to be drunk and defeat this enemy. That's what I have to say, Miriam.
Law and order. And Doctor, I know you want to come in, but also President Uhuru Kenyatta put on notice these leaders who are behaving badly. Well, you talk about the police also address that.
I want again to thank our television. We called them out here. We called the names.
That we did.
Yes. We want to thank the president for listening. We called the names here. I said here, the biggest offenders of this curfew are the government officials. Those who ferry people using government cars. And I want to thank the president for coming down on them. Nobody will be spared. Harwale, Harwale, Harwale. This time, the district commissioners will deal you a blow. You Mangamanga go to Wahaha again. You go to Trans Nzoia, Saboti. You go and address Kapondi. What are you doing with Kapondi? You and the Kapondi, what link do you have? We are beginning. There is an MP, a senator in Western, who addressed his people. He first collected their phones. You saw the picture yesterday. He called all MCS and other people, but he took away their phones. So what message is being passed to people in Western province? What is the message, Professor? We might be running on cake powder here. Harwale is crisscrossing the region, free from Kagamega up to Kimilini, up to Wahaha, up to Chebutais, Marikisi. This is my area where I come from. What is he trying to? What message is he sending? I'm a security man. I don't talk on this TV as a civilian. I talk as a man trained. And when I see signs of something which is wrong, I speak out. It is up to the security agency to check my tongue and find out whether I was right or not. That region there of supporting Kapondi and the group there, there's something going on that we don't want to exaggerate. That the security agencies put their ears on the ground. Now that the president has said no more rallies, no more political rallies were live. The district commissioners should bundle this Harwale, bundle him properly. There's a proper way. You know, people talk of democracy. Kenyatta has told you Kenya is an open society.
He did, yeah, he said that. And I thought that was a very interesting choice of word.
I liked his speech. He says, we have open society. That's why it cannot close you. All right? That's why they could not close you. Oh, thank you very much, my friend Thank you very much. It is you. Yes. Thank you very much. God bless you. Still, you can join the conversation. And Miriam should introduce the new person from Northeastern Kenya, our correspondent of the legacy trade from Northeastern. Thank you very much. He's coming in. Let him arrange his. We have got somebody from the Northeastern area. He's coming in. We are gonna tackle this thing of marginalization, water boreholes,
the revenue allocation.
The debate is going to be hot in the next few minutes. But let's finish this first.
Yes.
And we also want to thank Sodonio Kivandas from Mozambique. Thank you very much, sir. The COVID-19 is a human being situation. And therefore, the whole Africa, the whole world is affected. Thank you for your contribution all the time. And we want to advise you to send us your number so that you can always join us through Zoom from Mozambique. We want to create a great network of Africa.
Yes.
We want to discuss Africa from all angles. So spare us, send us your number on one of my numbers. They are on there. I'll see your message. And we shall come back to you, bring you on the Zoom. Now, coming back to what the president said finally, he put, which William asked, he hammered these guys. This is that apart from him, the president was meaning, apart from him, nobody else is above the law. So those who don't hear will see it. You go manga kwa church. Now you are giving bicycles and the motorcycles.
Yes, and Doctor, even as much as the president is the one who is slightly above the law right now, but also he's been the one leading in terms of keeping the law. He's not broken any law. President has not been attending any rallies. He's not been going anywhere. So he's leading from the front. So can we just follow that for our own sake? I think for the first time, just do that. Listen for your own sake and for your family's sake. So yesterday, according to the Daily Nation here, the front pages, it says Raila to the rescue as Uhuru reigns in troops. But we shall look at that in our next topic. But down there, down there it says no more beer with chips. I don't know even how you eat that. But unhappy with the casual manner a majority of Kenyans have taken towards the fight against COVID-19. Head of state tightens measures to stem the spread. So the curfew shall remain for the next 30 days. And also bars and eateries, bars shall remain closed until indefinitely. And also gatherings still remains banned. So do not go to these political rallies, and our leaders should be discouraged from having what we've been seeing lately there. So those are just the three things that stood out yesterday during President Uhuru Kenyatta's speech. So no more beer and chips, Professor. I don't know how they eat that, but apparently people used to just go order some chips so that they can have an opportunity to enjoy their drink there. But the president has said no.
You know, Miriam, this is where the cabinet secretary made a very terrible blunder. This is Africa. In Europe, people are disciplined as they are waiting for their food being cooked, being prepared. They can have 1 or 2 beers and they will rise and they will go. But do you know Kenyans which they were doing? Taking 2 beers in this restaurant, he moves to the other one, and he moves to that one, he moves that one. So they were just trying to circumvent the protocol which has been put in place.
All right, no cargo
Drinking is not going to go anywhere. And let me just have this to say, Miriam. I have never seen any Kenyan, unless you tell me this, who has died for having not taken beer. If there's one, please, I would want to see one who has died of not taking beer. But I've seen many Kenyans who have died because of reckless abuse of beer. And they have continued to spread this pandemic. So this is for assistance. Let us fight this war. We will win. There are so many veterans in our war. We shall win. And those who will want to continue drinking, you can drink. But now we are at war. We cannot afford to allow you to be drunk when we are at war. Everyone must have a role to play. And let me just also hammer this point which Dr. Masanga is putting across. And as a convict person, Mount Elgon is a conflict zone. We have had problem in that region for many years. Honorable Kabondi has been accused in court, having that he has got an army and he has got guns. And you start seeing people meeting secretly. Are you a fool? Is it not an indicator? Is it not something triggering this one? So, as Dr. Masanga is trying to say, the government has got the intelligence, must be able to investigate these characters and see whether there's something cooking. But I can assure you, there is something cooking. If they don't achieve what they want, ask yourself.
They'll resort to that.
We are at war. Yes. We are facing coronavirus pandemic. Why do you think others are not joining hands so that we fight this war? So there is another war they are preparing.
Yes.
We have given the education. We have created the awareness. Please,
let the security agency check our words. Thank you very much, Musa. Musa, good morning.
Morning, Dr. Masanga. How are you?
Thank you very much, my dear brother. Thank you for joining us. Can you test the microphone we are finalizing this topic of the president's address yesterday. He stopped alcohol. No more alcohol for 30 days. I know you don't take alcohol.
No, indefinitely.
So your region is okay.
Doctor, indefinitely,
yes.
not for 30 days.
Definitely.
Yes.
Let's check. If people don't behave, it will be banned. After all, you can drink it in your house. They will not stop you.
Yes.
But not to drink and disrupt everybody. Not to drink and fail to wash your hands. Not to call people that you are eating meat at 4 a.m. And you are civil servant. You are civil servant in the government of the Republic of Kenya. You are calling me from my bed to come and eat meat at 4 a.m. It is a very sad just the microphone, my brother Musa.
Thank you so much, Dr. Matsanga and the Punchline TV Africa. First of all, the address yesterday is that Kenyans, we have the habit of politicizing everything. And we are now reached a point of politicizing a pandemic, so sadly. And we should have taken, comparative analysis from what has been happening in, that unfortunate country called South Africa under Stephen Ramaphosa. Now they are heading to a record high number of people are dying in that country. And even when we go to countries where we can share some comparative analysis, like, Brazil and Italy, this is how they were behaving before the pandemic came. This is how they were reacting to the issues of alcohol. I recall in the northern part of Italy, people are really defiant. People are saying, we cannot follow what Prime Minister Conte is saying. But now here it is in Kenya. And Dr. Matsanga, yes, I might not be taking alcohol, but I have a good number of bars in my locality. And this town is a very cosmopolitan city. And what I'm seeing, last week, the county commissioner called on us on some university students to go and check on some, local pubs. And we saw people, seated close to one another. And the county commissioner said, maybe you just continue being seated in this manner because maybe you are downplaying the lower number of deaths. When the numbers shall be reaching, double or even triple digits, that is the time now you shall be starting to say, your Kenyan way, serikali saidia, we serikali saidia, sort of the stuff. And the county commissioner said, no, this is a global issue. The government cannot, come to help you, because the government is all about regulation. It's all about oversight role and protecting its citizens. And one thing even we are not understanding keenly here is that this is a global pandemic. Kenyans are behaving as if, alcohol is something which is only manufactured and brewed in Kenya. We have one of the largest consumers in the world. Go to Britain, people cannot, live without alcohol day in, day out. And so to Kenyans, and especially young people, the pandemic is now reaching at the peak of the curve. And so unfortunately, we should not be blaming the government in coming days when the numbers shall be triple, the numbers shall be even going to double that number in terms of the fatalities and the casualties we are going to have. So far, so good. Uhuru Kenyatta, the president, has done much. There is nothing you can expect from, a third world country which is even performing beyond the developed nation. Look at Italy. People, look at Brazil. Bolsonaro was defiant. He was saying there is nothing like Corona. There is nothing like COVID-19. But, President Uhuru Kenyatta gave us the alert. People are given these, hand wash. People are given masks. That is the best the government can do. Fellow Kenyans, you cannot expect more than that. The government doesn't have the capacity to manufacture a vaccine which has not been even advanced in developed countries. So the best we can do is to stick to these ideas. And Dr. Masanga, another issue here is, which is very pertinent. Kenyans, we are lords and we are, sycophants of misinformation. The other day, someone was saying Dr. Fred Matiang'i has been admitted to hospital. He has succumbed to coronavirus. When you look at the social media platforms and how people are, doing a lot of things on sharing of this information, we are not getting it right. We should be taking this pandemic as necessity for innovation, for necessity for invention, and even, to purge the way forward as a time of not attacking the government. People have seen, other flout of politicians with no ideological sense. I will proudly call them Tanga Tanga and other people who are busy shifting from one party to another. People are shouting that President Uhuru Kenyatta is not doing enough. What are you expecting Uhuru Kenyatta to do? He has done enough. What are you expecting him to do? Uhuru Kenyatta cannot buy you an Uber or a Bolt, a taxi to take you to home so that you can adhere to social distancing. The government is doing a lot. As far as the issue of, the issue of regulation is concerned, Dr. Matsanga, Muslims here, we are fully behind the government regulation. As far as alcohol is not our concern, the Crusade community are aware, are known to be chewers of Mira. I think these cat chewers of Mira. And the communities have said we can even fast for 40 days the way Jesus did, and we can just sacrifice for the sake of the, not for the government, but for the sake of this community.
Amen.
Yeah.
Amen. Thank you very much, Musa.
Thank you, Musa Gauma. Mm-hmm.
Musa, you bring in some sense of neutrality and a sense of pushing forward. Welcome to our team. Thank you very much. Welcome to the team. I think, Miriam, back to you in the studio.
Yes.
Let's go to the topic that is going to tear us apart.
No, it will not tear us apart. I think we just...
No, me and the professor on this one.
Don't worry.
Me, professor, and me, Aromba, Wesonga, and to some extent, Miriam. No, Miriam is not with me.
I'm neutral. I'm just here trying to bring the divergent rules. But Dr.
We shall see what Musa will bring from the location where he is in Northeastern.
Yes.
Thank you very much, my brother, for joining us. I've been looking for you for a long time. And
thank you
very much for joining the Punchline Group, the legacy trend. We want to develop the legacy trend to every corner of this region. We want to make it workable. We want to laud the president's agenda in the next remaining 736 days. I always count them every morning. That's where we are. We are remaining with that. Thank you very much. Now, Miriam, Aromba, can you hold your thoughts for the next show?
Yes, indeed, Doctor.
Because we want to start a show that will break this television tonight, this morning. Before the senators do it, fight, we shall fight here on this question of revenue allocation
formula,
which is paining everybody. And let's give very few remarks, point by point, hammer points, so that we don't waste a lot of time. Back to you, Miriam.
Thank you so much, and thank you so much. Our new addition there, Musa Galmadido, coming to us from the northeastern part, and also Samson from Kisumu, and Professor, and also Doctor. We shall be back, so please don't go too far, where we shall be looking at this revenue allocation formula that is now threatening to tear even the handshake apart. Is it really? We shall interrogate that when we return, so don't go too far. We shall be back.
Peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.